COVID has changed dentistry. Financially, we're behind. How do we catch up? It isn't by continuing to refer so much. Surgery is one thing we can do more of. Hi, I'm Dr. Koerner. Now with COVID, it's hard to do the same kinds of meetings as before. But recently I spoke to an AGD group via Zoom that was very effective and successful. We sent out kits of models and supplies for hands-on. Participants can use their own operatories with drills, or in some cases, they can use electric lab or implant drills at home. Some dentists were skeptical, but in a post-course survey, the percent of general dentists who would do this extraction after our training rose to 93%. That was a Zoom workshop, cutting, drilling, suturing, and eye-to-eye with me. They watching my work, my watching their work, and my critiquing theirs. Bottom line, all the evals were positive, and all the participants were pleased with the experience.
Like, I heard about Dr. Koerner before. I looked him up online to see what other people thought, and people had a general consensus that he's just a great instructor, so high expectations, and when he came in, like I said, he explained everything very well, very simply and easily, even for someone that doesn't have any experience in any of this. So I would recommend this to anyone who's trying to get their feet wet into surgical extractions. I'm definitely going to feel more comfortable doing extractions in the future after taking this course. It gave me all the appropriate tools and kind of skill sets that I think I need to attack different problems when I encounter surgical extractions. The live on course was great. To be honest, I was a little hesitant at first just because of the whole coronavirus time, and it's like, how do you provide a good oral surgery extraction course 2 states away? But then you guys shipped me all of the instruments, all the materials, and you had a very sophisticated model. So once you get stuck in one thing, you already have 5 other options in your mind, what else can I do? So I think that's one of the great things about the course.
When we get past COVID, things have to be different. A general dentist can't afford to refer so much anymore, especially extractions and other surgery. Let me know if you're interested. Contact me at karlrkoerner@comcast.net or 801-502-8585.